Well, my friends, this is the old video of a kid, a child aged about 1 year, came in the last week, 1st February 2025. My medicine was epismel 36 doses. The case was fever, continuous fever for 2 days or 3 days, and it was diagnosed from the children's hospital. Probably the case is a blood cancer because WBC was increased enormously and there was no chance of, no hope of the patient. In such a condition, the patient came to me. The previous video number 5038. I prescribed epismel on the basis of the symptoms sudden shrill piercing screams, and on further inquiry I have learned there was a history of repercussed eruptions, receding eruptions. So I thought the receding eruptions or repercussed eruptions, when the exanthema was not properly developed, there are some medicines, epismel, bryonia, cuprum metallicum, zincum metallicum, etc. It is not suppressed. It is called repercussed. That was not came out properly. If suppressed by ointments, the medicines are sulfur, sorinum, etc. But due to weakness of the vital force or by any artificial means, I mean supplying the anti-fever medicine, antipyretic medicines, when the eruptions are not able to come out, it is called receding of the eruptions or repercussed eruptions. 4 important medicines in homeopathy are bryonia, zincum met, cuprum met, and epismel. And another peculiar symptom of epismel, I observed sudden shrill piercing screams. Only by that peculiar symptom, I prescribed epismel. And I informed to the party whether the patient has been suffering from blood cancer or not. That is not my lookout. My lookout was to treat the patient by its symptomatology, by the constitution. So I prescribed epismel. So I accepted the challenge of this case, and I thought if the suppressive eruptions, repercussed eruptions comes out, it will help to cure the child. And today the child has brought to me. It is quite calm, no sudden shrill piercing screams, and surprisingly enough, there are some eruptions already come out. There are some eruptions come out. So I think the Harriman theory of suppression of skin disease, receding of skin eruptions, may produce any diseases, not only blood cancer, but also insanity, hypertension, diabetes, jerks and convulsions, epileptic fits, and so on. So I think the child will be improved slowly and gradually, and the blessings of God must be fall upon the child. I shall share you the next result after my next visit, and let's see the result, my friends. I do hope and I pray to the God to speedy recovery of the child, and he should come back from the verge of death, I mean the diagnosis of cancer blood. Let's see the result. We shall waiting for this, my friends. Let's see. So all of my patients of this clinic today are very much happy to see this case, and the junior physicians who are present at that day, they are also very happy, and they have learned the art of prescribing. No.